Congratulations, you just finished your first screening colonoscopy, but the doctor says that you have diverticulosis. What the heck does that mean, and what do you do about it? Diverticulosis, pouches that form in the colon, very common, especially after the age of 50. Benign finding, they don't go away, but you can prevent complications. Typically, recommendations for diverticulosis include eating a very high fiber diet. So you want to get a diet rich in fruits, vegetables, whole grains to really try to regulate bowel movements, prevent constipation. A lot of people get confused about diverticulosis versus diverticulitis. So diverticulitis is when you get inflammation or infection in those pouches. We would usually recommend then that you have a low fiber diet. In the past, we used to just prescribe antibiotics for diverticulitis. Now we're finding that we can just do bowel rest for a couple days, and as long as patients improve, then we don't have to do antibiotics. There are some cases where if you have like severe fever, bleeding, things like that, then we would go ahead and do antibiotics. Occasionally, people will have to be hospitalized if they have what's called a perforation or hole in the colon, and that's pretty rare. Sometimes if you have recurrent diverticulitis, then you may have to have a bowel resection, but also very rare. There used to be recommendations to avoid seeds and nuts if you have diverticulosis, but those recommendations have become obsolete, and there's no dietary recommendations except for high fiber. What I always tell patients though is that you know your own body. If you feel like you have more pain and it's worse when you eat nuts or seeds, then don't eat those things.